Fed did a survey, and 3/4 of Americans said they were doing okay financially. By last month, less than half of the people were saying that. Even when times were good, 3 out of 10 Americans said they didn't have enough savings to get them through 3 months if they lost their job. So that suggests even after a decade of growth, people were ill prepared for the calamity that hit this spring.
NPR's Scott Horsley. Thanks, Scott.
You're welcome.
And now a bit of hopeful health news about COVID-19. Early studies found very high death rates for patients on ventilators, but now some major medical centers are reporting more positive results. NPR's John Hamilton has the story.
COVID-19 has given ventilators a bad reputation. And Dr. Colin Cook, a critical care specialist at the University of Michigan, says that's unfortunate.
It's always disheartening to know that some people are out there saying, if you end up on a ventilator, it's a death sentence, which is not what we're experiencing, and I don't think it's what the data are showing.
Cook is especially concerned by a study of some New York hospitals that found a mortality rate of 88%. He says that figure was misleading because the analysis included only patients who had either died or been discharged.
And so folks who are actually in the midst of fighting their illness were not being included in the statistic of patients who are still alive.
Cook says many of those patients are likely to survive.
We think that mortality for folks that end up on the ventilator with COVID is going to end up being somewhere between probably 25% up to maybe 50%, somewhere in that range.
Scary, but hardly a death sentence. There's also encouraging data from some other New York hospitals, including Montefiore Medical Center in the Bronx. Montefiore serves the population with low incomes and high rates of diabetes, obesity, and other health problems. And in April, the medical center faced an onslaught of very sick COVID-19 patients. Dr. Michelle Gong is the chief of critical care medicine.
The number of patients with critical care needs was more than triple the normal levels.
Regular hospital wards became ICUs, critical care teams did extra shifts, and heart doctors were caring for lung patients. Gong says weeks later, it's